We often hear the phrase, history always repeats itself. And when it comes to immigrants, the US has a long and racist history of using immigrants as scapegoats for diseases. Let's take a look back, starting with the 1800s, when Irish immigrants were blamed for cholera, then Italians for polio, and Jews for tuberculosis. Later in the 1900s, Chinese immigrants were also blamed for spreading the bubonic plague, and today we see the same narrative using people of Asian descent to blame for spreading COVID-19. All of these are examples of immigrants falling prey to xenophobic and racist history and a way to continue their hurtful rhetoric that worsens the immigrant justice movement. Governor Greg Abbott lifted the mask mandate and many COVID-19 protocols in economic interests instead of the safety and health of the people of Texas. Currently, only 43.9% of people in Texas are fully vaccinated, and many Americans refuse to get vaccinated because so much misinformation is being spread by our government and health professionals. This is important to highlight because our government often uses immigrants as a scapegoat, when in reality, they're not enforcing COVID regulations and protocols and does not allow local governments to impose mask mandates, and public schools cannot be forced to wear a mask. Additionally, this past Friday, the U.S. Justice Department sued Texas after Abbott signed an executive order to restrict the travel of undocumented immigrants who could potentially have COVID-19. It is unconscionable that Governor Abbott is unleashing the state police to target people seeking safety and the good-hearted Texans helping them. We've seen time and time again that Abbott constantly uses border communities and immigrants to continue his racist policies and fails to enforce health policies to protect our communities. Individuals and organizations fill the gaps left by government inaction to ensure that people are welcomed with dignity and compassion. We need to protect all immigrants and keep Texans safe from COVID-19.